それではこれより分科会に
Ladies and gentlemen, now we would like to start the subcommittee 2, measures against antimicrobial resistance, AMR. The chair of this subcommittee session is Dr. Nobuaki Matsunaga, Chief of Division of Clinical Epidemiology, AMR Clinical Reference Center, Disease Control and Prevention Center, National Center for Global Health and Medicine Hospital. Dr. Matsunaga, over to you, please. Thank you very much. So we would like to start the subcommittee 2, measures against antimicrobial resistance. My name is Matsunaga. I am from AMR Clinical Reference Center. Thank you very much for having me, and thank you very much for this valuable opportunity. I would like to show my appreciation to this Fukuoka City and the Executive Committee of the International Forum. We are discussing this time from a One Health perspective, humans, animals, environment, and we would like to also include international cooperation in our discussions. We have a very prominent speakers from within as well as outside of Japan. First, I would like to discuss about the threat of a silent pandemic of AMR bacteria. And then next, the Harada will discuss the current conditions of AMR isolated from companion animals. And then we will hear from Dr. Dukta from the role of OIE. And then Ms. Dr. Kusumoto, AMR from the swine pathogenic E. coli, and then Dr. Suzuki, he has not lived that, lives not after death in an antibiotic resistant issue. And for those, Dr. Harada and then Dr. Dukta, there will be no question and answers because their speech has been pre-recorded. And we would like to hear the live and Zoom presentations from myself, Dr. Kusumoto, and Dr. Suzuki, and three of us will be having a discussion at the end of the session. So first of all, I'd like to give my presentation. I am Matsunaga from AMR Clinical Reference Center. I would like to present about the threats of a silent pandemic of AMR bacteria. Please show my screen. Thank you very much. Once again, my name is Matsunaga from AMR Clinical Reference Center. Thank you very much for giving me such a valuable opportunity to present on this topic to you. Well, very recently, I would like to share with my personal crisis, I would say. And on the down right, and I have the two birds, and then I have 9 of them. These parakeet, poll parrots, and then they one of them was hooked by some furniture edge, and then I urgently brought that parrot bird to a veterinarian office, and then the bird was fortunately rescued. So I'm really grateful for the veterinarians and who took care of my bird. And then I received the medicines for bird, and that was an antimicrobial agent, and I was told to give that drug to the bird for 2 weeks. Well, and then I checked about the drugs, and then because of my profession, and then I realized that I don't know details about the bird, their susceptibility or resistance, and then I don't know the guidance for the administration of the medicines for the small birds like my poll parrots. So even if I am expert in my own field of research, and I realize that I cannot really be fully knowledgeable as to what is the adequate treatment and medication for my bird, which is still the case. So without further ado, I would like to go into my main topic. And our AMR Clinical Reference Center was established in 2017 as an affiliate organization of MHLW. We have 3 offices, and one is an information and education support office, and in charge, and then the second is pharmacoepidemiology lab, and then the third is clinical epidemiology lab. We are also focusing on education and communication with the general public about the relevant information of AMR. That's particularly the role of Information and Education Support Office. And the Pharmacoepidemiology Lab is responsible of visualizing the actual usage of the antimicrobial agents and the situation of the AMR. And One Health platform related information also is to be made visible by our clinical epidemiology lab. So what is the burden of the AMR? And then according to O'Neill of the UK Department of Health, and about 700,000 persons passed away in 2013 because of antimicrobial resistance bacteria. And if nothing is to be done to prevent, in 37 years from now, it is estimated that approximately 10 million persons will pass away due to this particular cause, which will be more than death because of the cancer. And then 6 years after these findings of the research in 2019, the estimated numbers, the results became available. In 2010, since 2010, there has been some global action plans and measures were taken, and 1.27 million persons died directly because of AMR bacteria. Of course, we cannot just do the simple comparison, but then compared to the number of deaths in 2013, it's 1.7 times more. And you see in this graph the number of the deaths and then infectious syndromes. And then the LRI plus is the biggest cause of the death, and the second is BSI, the bowel infections, and the third is intra-abdominal disorders. So what's the situation here in Japan? This is about the bacteremia causing the death and the death number of the deaths. The number of the deaths because of bacteremia on the vertical axis, and then on the horizontal axis, the number of the years. MRSA, methicillin-resistant Staphylococcus aureus, the number of deaths has been almost constantly around 4,000 with a slight decrease. And FQREC, fluoroquinolone-resistant E. coli, the number of deaths due to this AMR bacteria exceeded MRSA, causing deaths gradually. And then because of MRSA, 3,966 persons died in 2019. And then because of FQREC, the number of deaths in the same year was 4,201. And in the same year, the number of deaths due to the road accidents was 3,215. So even if taking these two, AMR bacteria, MRSA, and FQREC, you can see the scale of the burden. And when AMR increases, and it will be detriment to health because when AMR increases, and it will be difficult to receive adequate treatment. One is that it will be difficult to treat cancers. If cancer grows, and then if the antimicrobial drug cannot be used, that will be really grave as a situation. And also it will be difficult to undergo surgery because prior to operation, surgery preparation, antibiotics, antimicrobials are used in order to prevent infection intra-GI tract, and also to prevent the encroachment of bacteria through cutaneous pathway. But if antimicrobial drugs cannot be used prior to the operation, you need to make a difficult choice. And also it will be difficult to play outdoor because if you play in a park or outdoor, and if you fall and if you have some slight injury or relatively deep injury, and if you have an AMR bacteria in the body, even if antibiotics, antimicrobial drugs are used, they cannot be effective. So it is important for us to maintain an environment where antimicrobial agents able to continue to be used into the future. So what will be the solution? Well, we should develop just a new antimicrobial drugs. Well, I thought that would be an idea as well. But as you can see in this chart, the development of antimicrobial drugs has been declining in volume and in numbers. So we have to be able to keep using existing antimicrobial agents. So what should we do for that to be able to happen? We need to implement adequate use of antimicrobial agents. So this is an international comparison of use of antimicrobial agents in Europe and in Japan from 2018. You see Greece, Spain, and the other European countries, and Japan is at the bottom of the chart. And we are on par as Hungary and Finland in the middle of the chart in terms of the volume of usage. And please look at what is in yellow. This is a cephalosporin and the macrolide. These are synthetic and quinolone. These are broadly used and they are synthetic antimicrobial drugs and they are having an impact on environment. And the usage of these antimicrobial agents in Japan are relatively high in volume, which is problematic in my view. Therefore, we need to reduce the volume of usage of each of those antimicrobial agents, and then we should try to achieve the level of the Netherlands, which is the lowest in terms of the usage of the volume. And what should we do? Well, there is this manual of adequate use of antimicrobial agents, because an adequate use of antimicrobial drugs is not no use of antimicrobial drugs. It is rather, it is to use them when it is necessary and adequate to do so. So what are the diseases and what should be the treatment allowing a cure? Those relevant points and focuses are identified and showed by these manuals, and the red flags for the absolutely important warnings are also included in this manual. For instance, and this is a one treatment flow chart. Well, there is a patient who claims that she or he has a common cold, but it's only the perception of the patient. So the physicians need to look into the symptoms and the conditions to eliminate the wrong possibilities, and then if there is no respiratory tract symptoms, the physician should look for other diseases than common cold. And if there are respiratory tract symptoms, then the physician should consider the possibility of influenza, and then need to be also very careful because there are other diseases which prevent breathing and which give a sore throat. So the physicians go through this through chart, eliminating wrong possibilities, and then if the conclusion finally is a common cold, then there is no need to use antimicrobial drug. This is a very simple logic which is explained by the adequate use manual. And there are other educational materials and not seeing, not hearing, not being effective. This is from a Japanese proverbs and saying that too much use of antimicrobial agents make them ineffective. And there are other educational materials. Now, from the year 2013 through 2020, what was the sales volume of antimicrobial drugs? You can see that the volume of antimicrobial drugs in humans per year declined, and it made a significant decline in volume in 2020. Well, we have been taking some measures against this situation. And then we looked into some further details because there are some impacts coming from COVID-19. Well, infectious diseases typically tend to increase in January, February, in winter. So it goes along with the increase in the sales and usage volume of antimicrobial and the COVID-19. But then in 2020, when there was a state of emergency declared, and people stayed at home, and then you can see that there has been possibly a quite significant impact coming from that, resulting in the decline of the use of the volume, usage volume of the antimicrobial agents. And then we have been working on this AMR control action plan. We tried to achieve to reduce the use of antimicrobial agents by 2/3 by 2020 to be on par with the Dutch level. We were not able to achieve that goal, unfortunately, but then for those regarding the cephalosporin, fluoroquinolone, and macrolide drugs, the volume decreased by about half during this period, which is, I believe, is good news. There are patients still, however, who are increasing in number, who are constantly in need of the use of antimicrobial drugs. And then in terms of the AMR rate of the bacteria, the challenge is very difficult still now. The very high rate of an AMR amongst bacteria has been gradually declining, but we have not been able to reduce to achieve our goals. And then you can see that in some cases, as you can see in this table, some of the bacteria have been enhancing their resistance. Yesterday, in keynote speeches, we heard about the Darwinist imperatives as well. Well, we are trying to fight against an AMR bacteria, but the bacteria are trying to always broaden their territories of existence and then try to grow in numbers. And in Japan, you can see that in 2018, there were local differences in terms of the volume of the usage of antimicrobial agents. You can see that for the western part of Japan, the tendency is to use more volume of the antimicrobial agents in general, and the same is true for MRSA, methicillin-resistant Staphylococcus aureus. So we need to differentiate the measures and actions in different parts of Japan as well. Now, One Health perspective is very important because it is necessary to take measures which pay attention not only to humans, but also to animals and the environment. There are pathways from such as transmission from livestock and into environment, and from environment back to humans. Because the human beings swim in lakes and ponds, and so there can be direct infections, and also infection can come through food, contaminated food as well. So it is necessary to take attention not only to humans, but also to animals and the environment. And then you can see, this is from 2016, what was the situation of usage of volume of antimicrobial agents in Japan across humans and animals. You can see that 32.8% of the agents were used for humans, and 46.1% used for animals, and 8.5% used in agricultural chemicals. Well, of course, it depends on the body weight and the size of the individuals, but you can see that significant volume and the proportion of antimicrobial drugs are also used for animals. And you can see in these graphs that the distribution of the used antimicrobial agents. The similar colors show the similar class. And then you can see that the blue types of drugs are more used for humans, and other colors, other types of and classes of an agents are used for animals. So we can see that there is some consideration being taken to differentiate between humans and animals. But the details and what are actually used are very important. When the domestic animals, livestock become sick, they need to be treated. This is very important from the perspective of animal protection as well. And then also the additives in the feed are also used for the more efficient nutrition and better productivity of livestock farming. For those purposes and reasons, as antimicrobial agents are used. So these needs to be carefully monitored and implemented. And then if AMR drugs are used in the livestock animals, then they become carriers. And then they carry antimicrobial resistant bacteria in the digestive tract, and there's cutaneous carrying of antimicrobial resistant bacteria, and also release of drug resistant bacteria with feces and urine into the surrounding environment occurs, and spread by flies with drug resistant bacteria, etc., happen as well. And humans also become infected in streets of towns and cities, and also AMR bacteria carried by individuals themselves can be transmitted to others, and they become also possibly infected by food carrying AMR bacteria, or they become infected in hospitals. But when they carry only on AMR bacteria, nothing happens. That's only carrying. But some of those individuals, when they become sick, they have symptoms, and there is a problem manifested because the antimicrobial drugs cannot be effective for the treatment. So in order to prevent such a situation to happen, we need to work on environment and antimicrobial resistance bacteria as a whole. So these are the flows in the environment of AMR bacteria from human population AMR bacteria going to environment without proper treatment. They directly go into the environment as is. And there are industrial pollution from manufacturing plants as well of antimicrobial drugs, and in the that released drugs in the environment can possibly become resistant. And also from animal agriculture, AMR bacteria can go into the environment, and from the environment, it can go back to humans. So as you can see with the dotted lines, we need to set up barriers to prevent those circulation to happen. And AMR action plans and SDGs are related with each other. We often hear talking about SDGs on TV, etc. these days, that there is such an affinity between AMR action plan and SDGs. And awareness and education, surveillance to let know the actual situations, adequate use of antimicrobial agents, physicians administering appropriately, patients using them appropriately, adequately, and R&D to develop new agents and infection prevention and management, and of course, international cooperation, so that on a globally basis, everybody and all the countries cooperate with each other to overcome this challenge of AMR bacteria. That is very important in my view. And human's life is, of course, very important, but also economics are very important as well. E. coli, Klebsiella pneumoniae, and then Pseudomonas aeruginosa by decreasing by half of AMR bacteria in these areas and the types of drugs. And we know that then the cost of an AMR bacteria can be reduced by half by 1 year. So that shows also the importance of this fight against AMR bacteria. In conclusion, I would like to emphasize the importance of One Health. And from the viewpoint of One Health, AMR bacteria countermeasures are very important, and the same is true for SDGs. And then, as you can see on the both sides of this slide, these are the slogans in the format of senryu, the Japanese short poetry, which are selected for the best ones each year, and the most recent ones are available on our website. Thank you very much. This is the end of my presentation. Thank you very much for your attention. Well, Dr. Suzuki, Dr. Kusumoto, if you have any comments or questions to my presentation, I would like to happy to hear them. Thank you very much. This is Suzuki speaking. Thank you very much for your clear presentation. You also gave an outline of this discussion, including my own area of expertise as well. Thank you so much. I have no questions specifically for now. Well, what about you, Dr. Kusumoto? Well, I would like to ask you one question. For instance, physicians of university hospitals and the clinicians of GPs. Are there any difference of perception and understanding in terms of the necessity and adequate use of antimicrobial agents between them? Well, in hospital settings, and there are premiums to be paid for the antimicrobial agents, and including for the prevention of infectious diseases. So I think there is a higher level of interest. And on the side of the GPs, well, when there is a common cold, and there is a premium that the GP can receive by not administering antibiotics because the diagnosis says that it's a common cold. So that is one factor of the tendencies observed amongst the GPs. And our manual and the guidance, and they can be distributed and reach all the GPs throughout the nation. But then the whole coverage in terms of awareness of all GPs seems to be a little bit difficult. So to summarize, I think that the current situation is that there is a relatively higher level of interest in hospital settings. Thank you for your question. When parents bring children to hospitals, well, fluoroquinolone is immediately administered in some hospitals, which is not truly good. But that type of medicine administration can lead to a better reputation of hospitals in some cases. So I think an education from for the hospitals not to administer too easily the antimicrobial is also important in my view. Well, thank you for your suggestion. It is indeed true. Well, when outcome is immediately positive, good, the physicians sometimes tend to use quite quickly the antimicrobial agents. But I believe it is very important to convey this message that it is not only the fastest outcome is the best solution. Thank you very much.
Now, I would like to call upon Dr. Kazuki Harada of the Tottori University. Please play the video. My name is Kazuki Harada. I'm with Tottori University. I would like to express my heartfelt gratitude to everyone involved for giving me this opportunity. I'd like to talk about the current status of antimicrobial resistant bacteria in companion animals. First, I would like to talk about the risks of antimicrobial resistant or AMR bacteria in companion animals. When antimicrobial agents are used in companion animals, there is a possibility of the development or distribution of AMR bacteria. If these AMR bacteria are pathogenic and cause infections, treatment with antimicrobial agents may be difficult, and this is a problem that has already arisen in clinical practice. On the other hand, since companion animals are members of the family and spend time with people in the home, it is possible for AMR bacteria to be transmitted directly or indirectly to people. If such AMR bacteria cause infections in humans, antimicrobial therapy in the medical field may become difficult. Although this public health problem has not yet been completely proven, it must be kept in mind when dealing with the issue of AMR bacteria in companion animals. Next, I would like to present the number of companion animals in Japan. As shown in the graph, starting in 2005, the number of dogs and cats kept in Japan has been on a gradual downward trend, and today there are approximately 10 million cats and 9 million dogs. The number of dogs was larger than that of cats in the past, But in recent years, the number of cats has been larger than that of dogs. To give you an idea of the actual situation of AMR bacteria in clinical practice, I would like to present the results of a past survey of clinical veterinarians. About 80% of veterinarians answered that they had encountered AMR bacteria while treating infectious diseases. From this result, we can say that AMR bacteria are very commonly encountered in veterinary clinical practice. As for the question of what departments the AMR bacteria were found in, a very high percentage of cases were found in dermatology, otolaryngology, and urogenital medicine. It was also found that AMR bacteria are commonly detected in infectious diseases affecting these parts of the body. This data, published in a paper this year, is the result of a questionnaire survey on the actual use of antimicrobial agents in veterinary hospitals nationwide. The results show that first-generation cephalosporins are the most commonly used drugs at about 40%, followed by penicillin at about 30%. The secondary choice of drug, fluoroquinolones, were used at the rate of about 10%. The paper also investigated whether the antimicrobial agents used were veterinary drugs, human drugs, or imported drugs, and the results showed that even for drugs approved for veterinary use, veterinary drugs were used in half or less of the cases, while drugs for human were used in a large number of cases. This may be due to the fact that human drugs are cheaper than veterinary drugs. The only exception was fluoroquinolones, where about 80% of the drugs used were veterinary. This may be due to the fact that there are many veterinary drugs of fluoroquinolones and that they are highly useful for animals. I would now like to talk about the reality of AMR bacteria, especially multi-AMR bacteria. First, there are a number of multi-AMR bacteria that are attracting attention in the medical field, especially ESBL-producing gram-negative bacilli, multi-drug-resistant Pseudomonas aeruginosa, carbapenem-resistant gram-negative bacilli, methicillin-resistant Staphylococci, and vancomycin-resistant enterococci. Among these multi-drug-resistant bacteria, only ESBL-producing gram-negative bacilli and methicillin-resistant staphylococci are of interest in the veterinary field, and the isolation of other multi-drug-resistant bacteria is extremely rare. From now on, I will discuss the current status of these types of multi-drug-resistant bacteria. ESBL stands for extended spectrum beta lactamase, and one of the characteristics of this enzyme is that it can degrade many beta lactam drugs. As a result, ESBL producing bacteria are characterized by a wide range of beta lactam resistance. This alone is sufficient for multi-drug resistance, but more seriously, many ESBL-producing bacteria have been shown to be highly resistant to other strains of drugs as a result of years of selection pressure. The figure inserted was prepared by the CDC in the US, and you can see that enormous medical damage caused. The isolation rate of this bacterium has been investigated in the past for each species, and the results are shown as follows. Although all the bacteria originated from cats and dogs, about 11% of the E. coli isolates were positive for ESBL. In addition, about 30% of Klebsiella species, 26% of Enterobacter species, 13% for Styrobacter species were positive for ESBL. ESBL was not detected from Proteus mirabilis nor Serratia species. As shown here, the detection rates differed depending on the species, even though they are categorized as ESBL-producing bacteria. In addition, according to the results of nationwide monitoring by the Ministry of Agriculture, Forestry, and Fisheries, about 1/4 of E. coli from dogs and 1/3 of E. coli from cats showed cefotaxime resistance. In the veterinary field, most of the strains that are resistant to cefotaxime are ESBL-producing bacteria, which indicates that ESBL-producing bacteria are distributed at a very high rate. In another report published in the past, ESBL-producing E. coli was closely related genotypes of the same ESBL gene serotype and sequence type were isolated from multiple patients in the same hospital. This suggests that nosocomial infection with multi-drug resistant bacteria may occur in veterinary hospitals, just as in human medical field. In yet another report, the distribution of ESBL genotypes of E. coli from companion animals and ESBL genotypes of E. coli from outpatients in Japan was shown to be very similar, with CTX-M group accounting for more than half of the cases, followed by CTX-M1 group. Although there have been no reports of direct sharing of ESBL-producing bacteria between companion animals and humans in surveys in Japan, it is necessary to continue to pay attention to this trend. On the other hand, according to the results of a survey in Hokkaido, a comparison of resistance genes between canine and human broad-spectrum cephalosporin-resistant fecal-derived E. coli showed that canine-derived strains mainly contained CMY2 and AMP C-type beta-lactamase, while the human-derived strains mainly contained CTX-M14 and 27 ESBL genes, indicating a different trend between the two strains. In this study, it was not suggested strongly that dissemination of resistant strains between humans and animals, especially dogs, could occur. This review, which is now about 10 years old, ultimately concluded that the opinion that animal ESBL-producing E. coli is a major source of human infections is oversimplified and neglects a highly complex scenario. This view remains unchanged, and we need to continue examining from all angles. Next, I would like to talk about methicillin-resistant Staphylococci. Methicillin-resistant Staphylococcus, commonly known as MRS, is characterized by resistance to all beta-lactams and, like ESBL-producing bacteria, is also highly resistant to other strains of antimicrobial agents. MRS can be classified as methicillin-resistant Staphylococcus aureus, MRSA, methicillin-resistant Staphylococcus pseudointermedius, MRSP, and methicillin-resistant coagulase-negative Staphylococcus, MRCNS. Although MRSA is not highly isolated from animals, it is considered to pose a risk of transmission to humans. MRSP and MRCNS, on the other hand, have a relatively high isolation rate from animals, but a low risk of transmission to humans. This slide shows the results of the nationwide monitoring by the Ministry of Agriculture, Forestry, and Fisheries of the isolation rate of MRS in dogs and cats. The results show that the oxacillin resistance rate of Staphylococci pseudointermedius, which has a high isolation rate in companion animals, is approximately 40% in dogs and 70% in cats, indicating that the methicillin-resistant status of this bacterium is extremely serious, at least. Regarding MRSA, which is considered important from a public health point of view, a study shown on the slide was conducted in the past. In this study, cases of isolation of MRSA were confirmed where same genotypes were found in the environment, human staff, and dogs of veterinary hospitals. Although the direction of MRSA transmission is not clear, many such cases of MRSA sharing between animals and humans have been reported internationally. In recent years, the concept of reverse zoonosis, in other words, infectious diseases that can be transmitted from humans to animals rather than from animals to humans, has emerged. And MRSA is taken up as one such example. Taking such a concept into account, it is necessary to consider how to manage the risks of AMR bacteria going forward. The route of spread of AMR bacteria in the community is extremely complex. The presence of AMR bacteria in companion animals presented on this occasion is only one part of the picture. There is an extremely wide range of other routes, including selection through exposure to antimicrobial agents in humans and animals, sharing between humans, transmission through food, and sharing with animal use for food. I hope that as the One Health approach gets adopted more widely in the future, we can elucidate such diverse transmission pathways of AMR bacteria. This concludes my presentation. Thank you very much for your attention. Thank you very much, Dr. Harada, for a great presentation. It is too bad that we cannot ask many questions. So the number of cats and dogs is going down, but there are more companion animals than there are the number of children under 15. So in that context, the use of AMR is quite widespread, and since it is quite cheap, it is possible that the AMR or antimicrobial agents are very much used. And then the reverse zoonosis disease, it shows the human-centric egoism in that rather than the disease coming from animal to human, it's possible that humans are giving diseases to animals. So humans should take measures against the AMR to help or protect pets. Dr. Suzuki, Dr. Kusumoto, if you have any comments, please go ahead. This is Kusumoto speaking. May I? It's just an observation, but compared to livestock, the monitoring of pets, I think it got started rather late. But going forward, I'm sure that more of monitoring will be done. But for instance, whether it's human or pets, the bacteria from the intestines can be replaced on a daily basis. So at what timing you would take the sample, that may be difficult. Well, that's one point. And also with humans and animals, what kind of bacteria can be transmitted or adapted, or what kind of genes can be shared. Monitoring on those points can be quite labor intensive, but animals are very close, especially the relationship with pets and humans is very important, I thought. Thank you very much. As long as I know, the monitoring of the AMR in pets, I heard that Japan is ahead of other countries in monitoring this. So after using the antimicrobial agents, the animals might act or behave differently. And also, if you look at the direction of a genome study, then perhaps we can gain understanding in a good direction. Thank you very much for your wonderful comments. Dr. Suzuki, do you have anything that you'd like to share? Thank you. That was quite interesting. Pets are animals, but they live with the human. So the bacteria can be quite similar and the resistance can be quite similar, but the biology is quite different. So there are commonalities and differences. So it may be difficult to discern that. And also the use of drugs. The human drugs are cheaper and therefore were being used more often. I found it interesting. Actually, that is quite problematic. Thank you. Thank you very much for summarizing very succinctly. I think it's very important to look at the commonality and differences. Pets live together, so it's difficult to isolate. So going forward, it's probably quite difficult to isolate the cases for humans and the pets. So we were having this conversation outside of the field, as it were, but now I'd like to move on to the next presentation.
So the next.
有益事務局、アジア太平洋地域事務所、リージョナルプロジェクトコーディネーターを務められております、金山デュクバ先生より、次のパンデミック防止における OIE の役割についてご発表いただきます。それでは動画をお願いいたします。
Hello everyone. I hope you are all keeping well. Firstly, let me introduce myself. I am Kinzang Drukpa, working at the OIE regional office in Tokyo, Japan. I look after One Health activities, including rabies, zoonosis, and AMR. Today I'm going to talk about the role of OIE in the prevention of the next pandemic, taking antimicrobial resistance as an example. This is the outline of my presentation. For the background, I will briefly introduce the burden of antimicrobial resistance and the key drivers for emergence of AMR in animal sector. Thereafter, I will discuss some key issues on AMR that are prevalent in the Asia-Pacific region. Then I will talk about what we do to address AMR. Lastly, I will leave you with some take-home messages. We know that AMR represents a major global threat across human, animal, plant, food, and environmental sectors. According to a study by O'Neill in 2014, it is estimated that currently around 700,000 annual human deaths are attributable to AMR. We may see human deaths jump to nearly 10 million by 2050 if no action is taken. An example from Japan has been shown here, where AMR resulted in more than 30,000 human deaths in 2017 due to bloodstream infections. So therefore, as you can see, AMR is often called as a silent tsunami or a ticking time bomb. And because there are multiple drivers for the occurrence and spread of AMR, we need a One Health approach in addressing AMR. In this slide, I want to show you some of the key drivers of AMR in animal sector. As you can see here, human population is expected to reach nearly 10 billion by the year 2100. Because of this, and due to increasing purchasing power, there has been an increasing demand for animal protein over the last few decades, especially from the growing economies such as China, India, and most countries in Southeast Asia. Due to this surge in demand for animal protein, over the last few decades, we have seen a transformation of the livestock production system from a largely backyard farming to a commercial farming system where animals in large numbers are reared under intensive system, making them more vulnerable to diseases. With intensification of livestock production activities, the need for enhanced hygiene, husbandry, and biosecurity practices increases as animals get more vulnerable to diseases. In order to circumvent economic vulnerability to diseases, the producers may likely face in such farming systems. They often resort to misuse and overuse of antimicrobials in replacement of good husbandry and biosecurity practices. It has been projected that by 2030, there will be nearly 50% increase in antimicrobial consumption in Asia. Based on our work on AMR and antimicrobial usage, I would like to highlight some of the key issues on AMR in the Asia-Pacific region. Many countries in this region, the legislations and regulations are either weak or weakly enforced, and therefore there is ineffective regulation of import, production, sale, and monitoring of the antimicrobials used in industrial production. There is inadequate supervision on the usage of antimicrobials in animals, and the use of antimicrobials as growth promoters without risk analysis is also quite widely prevalent. Overall, the AMR surveillance system is quite weak, and also there's lack of awareness on AMR. So all of this actually lead to quality issues, inappropriate use, underdosing, and which eventually contributes to the development of AMR. The OIE has been working on AMR since many years. Since 2015, with the rise in global momentum to address AMR, the OIE also launched its global strategy on AMR and the prudent use of antimicrobials in 2016 that consists of 4 key objectives of improving awareness and understanding on AMR, strengthening knowledge through surveillance and research, supporting good governance and capacity building, and encouraging the implementation of national or international standards. We undertake several activities to support actions against AMR in the Asia-Pacific region. As a global standard-setting body, the OIE's standards and guidelines on AMR provides the latest scientific information that members can refer for their AMR, AMU activities. Chapter 6.10 of the Terrestrial Code and Chapter 6.2 of the Aquatic Code provides details of how countries can implement responsible and prudent use of antimicrobials to prevent the emergence of AMR in animals. This also includes the roles of various stakeholders that I will discuss in the next slide. The OIE standards provide details of how each stakeholder has a role to play within the AMU supply chain in ensuring prudent and responsible use of antimicrobials. Stakeholders such as government regulators, pharmaceutical industries, importers, wholesalers, retailers, animal feed producers, farmers, producers, consumers, and also the veterinarians and veterinary students, they all have a role to play in addressing AMR, as I will explain in more detail later on. As I mentioned earlier, each stakeholder has an important role to play. For instance, the government regulator, they are responsible to develop and implement legislations for prudent and responsible use of antimicrobials. Likewise, the private sector, that can consist of drug manufacturers, importers, retailers, and also feed manufacturers, they should comply with good manufacturing practices. They should also comply with the government's regulation and also share the AMU data with the concerned government sector. For the food animal producers, they should comply or apply good animal husbandry practices, and they should only use antimicrobials when prescribed by veterinarians and also comply with the regulations. And also for the consumers, they also have a very important role to play by being aware of what is AMR, and they should try to lobby with the politicians and policymakers to spread the word about AMR and to lobby with the policymakers to formulate and implement laws related to the addressing of AMR. The OIE published the list of antimicrobials of veterinary importance into 3 categories: veterinary critically important, veterinary highly important, and veterinary important antimicrobials. Amongst these 3 VCIAs, there are some antimicrobials that are critical for humans, such as the fluoroquinolones, 3rd and 4th generation cephalosporins, and colistin. The OIE strongly recommends that these categories of antimicrobials are not to be used as preventive treatment in feed or water. They should not be used as the first line of treatment unless it's based on laboratory tests. They should not be used for extra label and off label unless there are no other alternatives, and they should never be used as growth promoters. One of the biggest challenges faced by countries in addressing AMR is the weak monitoring of antimicrobial usage. The OIE has organized several AMU monitoring workshops in many countries, bringing in the key stakeholders responsible for antimicrobial usage and assisting them in strengthening their AMU monitoring system. This is a typical AMU supply chain that has been developed based on the workshop outputs, which shows the flow of antimicrobials from import, manufacturing, until they are used at the end users. And the supply chain also identifies the different stakeholders that are responsible to regulate the antimicrobial usage, and also the type of AMU data that each stakeholder at each level can provide to the government agency. So the OIE strongly recommends that countries undertake the monitoring of antimicrobial usage very strictly so that they understand the supply chain of antimicrobials used in each country. The OIE has been mandated to monitor the global usage of antimicrobials in food animals based on the AMU data provided by countries. As per the 5th OIE Global Report on Antimicrobial Usage that was released in 2021, we are now seeing a decreasing trend in the overall usage of antimicrobials in animals. However, the Asia-Pacific region, as you can see in this graph, is still one of the highest consumer of antimicrobials in animal sector as compared with the other regions. And currently, 12 countries in the region, they still use antimicrobials for growth promotion. As bulk of the antimicrobials used in veterinary practice and livestock production are used by veterinarians and livestock producers, it is critical to create awareness on the prudent and responsible use of antimicrobials amongst these stakeholders. Therefore, the OIE, we organized workshops targeting these key stakeholders, such as the livestock and aquaculture industries, the veterinary services, veterinary universities, and veterinary council in many countries in Asia, and we encourage them to make use of the OIE standards and guidelines for responsible production, and also use these guidelines to improve the curriculum, the veterinary education curriculum, incorporating the essential elements on AMR. We are not working alone in addressing AMR. We work together with our regional tripartite colleagues from FAO and WHO, and most recently with the UNEP, in implementing several activities to keep the agenda of AMR high in the region. We organize joint awareness meetings, webinars, joint monitoring and evaluation of the AMR National Action Plan in countries, and joint projects on AMR. We are currently implementing AMR multi-partner trust fund projects in Cambodia and Indonesia, and will soon launch an EU-funded project on AMR in 9 countries in this region. This is my last slide. At the end of today's seminar, I want you all to remember a few messages that should continue to ring in your ears. Firstly, we should recognize that AMR is an emerging threat to humanity and is destined to be the next pandemic unless we take action sooner than later. And AMR is occurring because of the inappropriate behavior or use of antimicrobials in humans and animals. And we need, every one of us has a role to play, and we could be an ambassador, AMR ambassador, and role model to bring about positive changes in bringing about behavior change in the use of antimicrobials. Let us all work together to address this next pandemic so that we can prevent the occurrence of this next pandemic that is likely to be caused by AMR. Thank you for your attention, and I wish you all the best for this workshop.
Thank you, Dr. Dikpa. Thank you so much. Well, we have immediate incidents that requires immediate attention, and you actually explained in full length. As the population expands, we are having to support a large amount of food. As a result, it's becoming more difficult to control the antimicrobial used in the agriculture and farming. But there are so many stakeholders involved. We must foster the understanding of each of the stakeholder. I was able to fully understand the needs for such efforts. Dr. Kusumoto or Dr. Suzuki, please. Yes. When you're actually prescribing antimicrobial to animals, in the past, we did use it as a growth promoter. And as it is being banned, not only it is supposed to be banned, but is it really the case? If you really look at what is happening in the field, quite often, some of the antimicrobials are included in the feeds. So do you have any idea, or do you know anything about that, Dr. Kusumoto? Yes, as a growth promoter, we're not supposed to use them. That is true, but it is actually quite often added for smaller animals, young animals, to, in a sense, promote growth. And we are trying to control it. There is action plan for that. However, for the producer, they're concerned about if they don't have the such agents, what would happen? So if those agents are not added to the feed, does it really help improving the situation around the AMR? So actually, the ministry is working on the study as well, whether there is actually a positive impact by avoiding growth promoter in the feed for younger animals. So, I think while the study is going on, I think that practice will continue for a while. Thank you. Yes, it is important that we reduce the incidents in independent animals. But I understand overall there is a positive trend in the use of antimicrobial. Yes, Yes, there is a concern on AMR, and it's just not just one agent. It's a multifactorial. So multifactorial. So when you reduce two different types of agents, in which depending on what type of agent you reduce, there is a different impact. I see. But are the producers aware? Do they know that there is actually antimicrobial included in the feed? I think more producers are aware than they're not, but I don't think they are proactively checking. I think they learn it from their veterinarians. But in principle, I think they are aware. I see. I see. Thank you. Is there anything else? May I? Just a comment. In Japan, half of the meats are actually imported from outside, and we do have live animals imported from outside. So the usage outside of Japan is also a concern for us. And how well we are able to control on the borderline is another issue. While we try our best, we must actually, and it's not enough. We have to actually learn how to control the situation in Asian area. And if you look at Europe, because they are so ahead of us in terms of farming, and they have much better control and they refrain from use of antimicrobial, and they are still being able to have successful production. So I think there is a way. In the veterinarian area, in the prudent use is the word we use. Before appropriate use, prudent use is you have to make a prudent judgment, then make decision based on a very in a prudent way, then appropriate use. So that's there's a distinction. I see. I see. You have to judge. It's just like a human. You have to judge whether it is appropriate, then carefully use them. Thank you. Thank you so much. Now let's go on to the next topic.
グループ長を務められております。
Now I would like to invite Dr. Kusumoto, leader of Enteric Pathogen Group of National Institute of Animal Health of National Agricultural and Food Research Organizations, and about antimicrobial resistance in swine pathogenic E. coli. Thank you very much. Can you see my screen? Yes, we can. So I am Kusumoto from the National Institute of Animal Health of NARO. I would like to present about antimicrobial resistance in swine pathogenic E. coli. So I'd like to discuss mainly swine. First of all, this chart shows the sales volume of antimicrobial agents in Japan, estimated sales volume by type of animals. As you can see at the first glance, you can see that a significantly large volume each year of antimicrobial agents are used for and in swine every year. And most of them for swine are for treatment purposes, but 20% of them are used as additives to feedstuff. As Dr. Matsunaga mentioned, those used antimicrobial agents, amongst them, approximately 40% of them in Japan are used in humans, and the remainder, about 60%, are used for animals, including as additives to feedstuff. And then a similar situation can be found in other countries such as US. So in many countries in the world, a lot of antimicrobial agents are used for animals. And this is the breakdown. Dr. Matsunaga also discussed the distribution of antimicrobial agents in human and animals. There is a tendency for animals to see the usage of an agents which are not typically used for humans, but then there's a lot of similarities, and peptidoprimyxin and then hook is here, and the colistin is also here. And one characteristic is that the peptide, the polymyxin, as it is called overseas. One of them is a polystyrene, and then in humans, and it has started to be used as an agent to be used against multi-drug resistant. And then since July 2018, it has become prohibited for this agent to be used as an additive to foodstuff. Previously was used significantly in that particular area. And these are drug resistance equally isolated from healthy livestock, from beef, cattle, broiler, and swine. Well, in beef cattle, there is a relatively small volume of an antimicrobial agent used. So the rate of the AMR equally is also low. As you can see, this is the level of the broiler, and in the case of swine, you can see quite high rates of drug resistance E. coli. For broilers, there are relatively high level of drug resistance, and E. coli is isolated from broilers, while the volume of the antimicrobial agents used in broiler is relatively small. So the research has been recently starting to focusing on broilers as well. Now back to swine. Well, these are two types of the pathogenic E. coli. One is the intra tract of GI. Those are the E. colis, and then this VF factor is enterotoxin, and then the in terms of the disease, neonatal diarrhea and post-weaning diarrhea causing the death of very young swine. And the other toxin is a Shiga toxin. This is the toxin from the same family from the E. coli causing 0157 in humans. And then edema disease is caused by Shiga toxin, which is a nerve system disease. And then this is a situation of cases happening in Japan, and then the number of swine. The number of swine in livestock farming of swine has not changed significantly, but then the disease cases in number have been declining, and particularly that has been the case of diarrhea. The root cause is not completely revealed for that yet, but perhaps we can believe that there is an impact of an improvement of hygiene in the livestock farming environment, and also the sophistication of the farming method. And no significant change was observed in terms of edema disease. And these are the E. coli data regarding the E. coli isolated from swine having diarrhea or edema disease. And this is by type of serological types in serogroups. Those E. coli isolated from 6 swine in Japan in the period of from the 1991 through 2019. The total number of N is 1,708. And you can see that there are 4 major serological types, which are the major ones, and 0139, the biggest one in number and in percentage, and the second biggest, 0149. They are major serological types in all serogroups which are isolated across the world, while 0116 and OSB9 were only identified in Japan. Now, the changes over time, over these years of the serological types are, as you can see at the bottom, in the period of 1991 through 1999, the 0139 and 0149 were the absolute majority, but then 0116 and OSB9 gradually increased over years. And one thing we should not overlook is the others. These are the other types which cannot be classified in neither of these 4 types, and the percentage of others and have been growing. That means that there has been a further diversification of serological types of E. coli. Let's look at the regional and local distributions. In green on this map, and there was a sampling conducted, and then a darker green regions had a larger number of samples taken. And then this is the distribution situation. The first comment I can make is that, as Dr. Matsunaga mentioned, there are local differences. That is also applicable to the distribution of the livestock animals. And in similar areas, there are similar patterns when the areas are geographically close to each other. And so it is, we can say that it is unlikely that the AMR bacteria will be widespread immediately across the nation. So the differentiated measures can be taken depending on the situation of each areas. And then now I would like to say a few words about the pathogenesis related genes. Diarrhea and edema diseases. So regarding these 2 diseases of swine, there are bipolarization, relatively speaking, of the types, serological types of E. coli causing those diseases. In the case of edema disease, and overwhelmingly it is caused by O139, and the O149 has been increasing in recent years. In the case of diarrhea, O149, O116 are the prevailing ones, and OSP9, which is specific to Japan as well, along with the O116, it is the one which is following. In the case of strains isolated from edema disease, you can see the vaporization typical too, and then there is a further distribution and diversification in the case of the diarrhea. And with the F and some numbers, as you can see, these are the factors settling, and then they are probably not settling in humans. Intimine can be, however, settling in humans. That's across animals and humans. So the transmission from animal to human, human to animal, intimine is one which we have to pay attention to. But the actual occurrence rate of transmission with intimine is relatively low. Now, we conducted the drug sensitivity test with all these antimicrobial agents, and they are used against an E. coli, and these 3 agents are not used in livestock farming animals. But then we included them in this sensitivity test in order to identify their characteristics. And then these 3 at the bottom of the slide are mainly used in animals. So in total, 24 antimicrobial agents were subject to this drug sensitivity test. So, and then we looked at the major serological types in the all sero groups in terms of their drug sensitivities. And fluoroquinolone, CPFX 0116 in pink color and OSB9 in yellow color. These serological types compared to other types, they have a very high resistance against the fluoroquinolone. And O116 has almost 100% of resistance to fluoroquinolone. Fluoroquinolone is a second line therapy, and this high rate of resistance to this particular agent cannot be overlooked. So this pie chart is the same one as that I showed previously. O116 and OSB9, these are the specific serological types specific to Japan. As I said earlier, in the past 10 or 15 years, these types started to exist, and they both of them have a very high resistance to the fluoroquinolone. We looked into some further details. O116 and OSB9, the level of their resistance to fluoroquinolone is the result of accumulations of many mutations in the QRDR or resistance determined regions of resistance to fluoroquinolone in chromosome. And also, those types O116 and OSB9 were isolated from farms with, where quinolone or fluoroquinolone antimicrobial agents were never used. So that means that there was an encroachment from other farms. And then, and in other words, when the use of quinolone or fluoroquinolone is stopped from in a given farm, the AMR bacteria against the quinolone and fluoroquinolone, those E. coli from that farm will not disappear. And then similar bacteria in many cases are isolated in a neighboring farms. So we can presume that there is an encroachment from an nearby other farms. And on 116 and 01 OSB9 also are resistant to gentamicin, gentamicin being relatively frequently used in livestock farming animals. So the choice of an available antimicrobial agents for those animals is narrowing. Now, this is a comparison with E. coli isolated from healthy swine. This is from a JVARM program, which is the farm test program of MHLW, the ministry. And then the green bar chart shows the data for 4 years from 2014 through 2017. And then you can see different colors and showing different serological types of E. coli. And now the E. coli isolated from 6 swine has a lower rate of distribution of an AMR bacteria compared to E. coli isolated from health. The higher distribution of an AMR bacteria can be seen in E. coli isolated from 6 swine compared to E. coli isolated from healthy swine. So amongst the healthy swine, rate of distribution overall, broadly speaking, of AMR bacteria is low. And then from 6 swine, there are a lot of swine pathogenic E. coli isolated. So we can presume that that is caused in many cases by the use of drugs for treatment purpose. And then also the mutations, as I mentioned, are accumulated in the process evolution in the swine pathogenic E. coli, resulting in the characteristics of AMR. And then tetracycline, streptomycin, they are also used as an additive to feedstuff, and they are also used for healthy swine. So we can see even in healthy swine, the rate of resistance is almost as high as in the case of 6 swine. Now back to the pathogenic E. coli. We conducted this test about the major O cell groups serological types and their respective level of multi-drug resistant. We conducted 24 types of them. And then this is once again the same pie chart of the distributional type of serological types of all cell groups E. coli, one OSB9 and O116 peculiar to Japan, and then 0139, 01409, 0116, or SB9 are the four major ones. Now, in the blue bar chart, on 139 and 149, having a peaks at the place I pointed with the cursor. On the 116 and OSB9, which recently have been increasing in Japan, having a peak levels in this area, and then showing the resistance to 9 or 10 types of antimicrobial agents. So the multi-drug resistance is increasing. And then some data show that then those AMR bacteria have been increasing in terms of their presence in more farms. So we have to pay attention, particular attention to them in terms of their prevalence. And you can see out or untypable ones show some resistance in these areas, and then some of them are resistance to so many drugs, and then only carbapenem can be used effectively. So we need to be very careful about them and pay a lot of attention. This is my wrap-up slide. The isolation of pathogenic E. coli from swine is changing with more and more new serotypes and the genotypes being isolated in addition to the traditional ones. As I said, in addition to 0139 or 109, which are traditional ones, we have been seeing more OSB1 and 0116 in Japan. And then the 0116 and OSB9 are new strains of pathogenic E. coli characterized by high level of multi-drug resistance and fluoroquinone resistance. And also, pathogenic E. coli is more likely to be drug resistant than E. coli from healthy swine. And this is probably due to the use of the antimicrobial agents for treatment purpose. We need to be careful about it. And from the viewpoint of One Health, the resistance of 0116 and OSB9 are because of the mutations occurring in QRDR, or quinolone resistance determining region on the chromosomes. And then they are not directly transmitted to humans. So we can say that the impact of that on the infectious diseases, infection of humans, is relatively small. However, factors related to high level of multi-drug resistance can be possibly transmissible to the humans. So we need to reveal the details about it through large-scale genome analysis. Thank you very much. Thank you very much, Dr. Kusumoto, for such wonderful presentation. You already gave a summary and wrap up, so I will not wrap up your presentation. I'd like to just ask some questions. Well, diarrhea and edema diseases, in the case of humans, and sometimes without the antimicrobial drugs, the humans can be cured, and sometimes it's better not to use those drugs. But is it better to use those agents in the case of swine to cure them for these two diseases? Yes, particularly in the case of diarrhea, neonatal, 2 weeks or 1 week and old swine get the diarrhea, and then if nothing is done as a treatment, they just die. And sometimes when they are found with the diarrhea, they are already dead. So what is actually done is that once those very young swine die due to diarrhea, the other animals, the other pigs in the same farms are tested. And the edema diseases are typically prevalent in the 3 months or so old swine. And then there are dormant cases as well, but we don't know actually what's the real size, scale of the dormant cases. So on a cautious side, many of the swine receive an administration of antimicrobial agents. Well, thank you very much. And on the TV, we see that sometimes raw meat from overseas is brought into Japan. Is it something which is related to the new types of E. coli that we are seeing in Japan or from Asia, for instance? Well, MST is a testing method to identify different types of genes. From based on that results of that test method, we can see that there is a new population. It is true, but in terms of pathogenic E. coli, we need to reveal their true origins by conducting a proper genome analysis, and although there are some hypotheses. Thank you very much, Dr. Suzuki. Do you have any comments or questions? Well, thank you very much for your very interesting presentation. I have one question. Swine and humans. I mean, the human beings who are working in the livestock farming farms for swine. Has ever a common plasmid been discovered across them, humans and swine? In the case of E. coli, I don't think so. But then there are some cases where we can presume that the humans became sick through transmission from swine. So transmission can be possible. I think we can say that. However, the pathway is not that simple, so it between swine and humans. Thank you very much, Mr. Kusumoto. Thank you very much. See you later for the discussion.
Next speaker is Dr. Satoru Suzuki, who is with the Center for Marine Environmental Studies at Ehime University, with a presentation entitled "Pay Attention to He Has Not Lived That Lives Not After Death in Antibiotic Resistance Issue." Can you see my screen? Yes, let me start. My talk today is entitled "He Has Not Lived That Lives Not After Death," which may be nonsensical, but it's one of the old proverbs in Japanese. This is one version of the translation of old proverb or a proverbial expression in Japanese. I don't have any disclosure of conflict of interest. Now, this is the content of my talk today. So there's water flowing from freshwater system to the sea, but the dynamism of the antibiotic resistance genes, ARGs, is important. So I will talk about that first. Secondly, the ARGs, antibiotic resistance genes in the sea, it can persist and disseminate. So I will talk more about that. And then lastly, this is something that I'd like all of us to think about this. The linkage between the sea and our life. If you think of the risks associated with ARGs, what are the implications? That's what I'd like to talk about. First, on the first topic, if you look at the dissemination of ARGs, you have to think about the horizontal gene transfer, HGT. I'm sure you're aware of this. And if you think about this, the water environment is one way of sink where genes would accumulate. And then there's another aspect, which is linking. There is a place where ARGs can come and go. And if you look at, or if you think about bacteria, humans and animals, as many doctors have touched upon, there are many common bacteria that are shared between the two. Half of the human infectious diseases are zoonosis, so there is high level of commonality across these two. So between bacteria of humans and animals, it's possible that genes can be transferred. But if you look at the environment, it gets quite complicated. There are microbial organisms that only live in the environment, especially in the aquatic environment. the bacteria there can be quite different. Another point is there are bacteria that come from the land, and these two can be mixed in certain environments. So when considering One Health, we need the knowledge of the specificity of aquatic ecosystem and bacteria. This is an example of water-derived bacteria incident. I'm sure many of you know about this Acinetobacter baumannii. It happens almost every year. This is news that came out of Germany, JAMA, sorry, when when COVID-19 patients surge, there are many incidents of Acinetobacter baumannii. It happened in Japan as well, and one of the cases that we can learn from is that there were human errors. The same bacterium or the same bacteria have been detected in the past in the same hospital, or there was no information sharing of the bacteria being detected in wash basin and mattresses. So the medical staff didn't know about this and ended up transporting the bacteria to ICU. Another point is the characteristics of Acinetobacter species. They are quite common and they are water or aquatic species, but they're strong against dryness and there's high rate of gene transfer. So because of these reasons, these can frequently cause nosocomial infection. Now on the aquatic species, there are a few hotspots. Hotspots are where there is a lot of use of drug and there's a lot of selection pressure, and that leads to ARGs. So there's agriculture and the livestock farms. Another hotspot is hospitals. And what's becoming more problematic is the discharge of water from pharmaceutical factories as seen in India. As for the wastewater treatment, wastewater of human excrements, it gets to treatment plants, but quite a lot of that gets dumped in the river and the ocean. And then there are hot spots in the ocean as well. These are aquaculture spots. So ARG possessing bacteria and the release of antibiotics can come from various sources. What we have to think about are following questions. Do ARGs that come into the sea, do they disappear or do they persist? Or do they even increase once they get to the ocean? Also, in this oligotrophic environment, how is the gene transfer taking place? And finally, the ARGs in the sea, do they invade or encroach into human society? That's something we should think about, or I would like to think about. And secondly, this is the picture of a food chain. And if you look at it in the ocean, the primary producers are phytoplankton using photosynthesis, and that gets eaten by zooplankton and then eaten by predators. And at each of the level, there are carcass and excrement that gets produced in each of the steps, and those organic matters get dissolved and become dissolved organic matters. Part of a DOM can be or would be utilized by bacteria, and those that bacteria is the only one that can reutilize this. Bacteria are too small to be eaten by plankton. Before that, they get eaten by protists, and there's grazing pressure that is at work. In the past, once bacteria is digested, there was nothing that would remain. That's how it was thought of. But if, as you can see from the environmental DNA, we came to know that DNA residue would remain and DNA fragments and plasmid would remain. And what's problematic is fragments and plasmid would potentially function as gene. So in the environment, there's one scenario where the genes can persist in the environment. And then the plasmid could persist in the bacterial cell. So this is PAQU1, that's in plasmid, and then there's transconjugant E. coli. What's at the furthest right is the wild type of E. coli. This was derived from the feces of cows. And then these have tetracycline resistance, and it's from 0 to 2 microgram. Under all the conditions it was investigated, and the 3 charts at the top are total number of cells. In 1 month, there's no change in the number of total cells. However, if you look at the number of colonies that were cultured, the number gets decreased over time. This is viable but non-culturable. So they are viable but not culturable. So for instance, the one in the middle, it's hardly detectable. The colonies cannot be detected, and you might conclude that there are no colonies. However, in that sample, plasmid, if you look at the charts at the bottom, over the whole 1 month, they continue to exist. Even if they go into the form of B and C, they remain as plasmid. So for instance, with this PA1, plasmid would persist. And in the case of ink FIB, there are few. So plasmid, regardless of there's selection pressure or not, or if they're culturable or not, they stably persist. This is the summary of gradient pressure and selective pressure. Generally, once they're eaten by protists, bacteria would disappear, but certain plasmid and ARGs, they would remain at a residual background level. And also, if there's antibiotics, bacteria continue to hold the plasmid to resist. But once it's gone, if there's no selective pressure in the environment, otherwise plasmid gets eliminated. That's what it was thought. Of course, there are some examples like that, but actually plasmids in the environment, the number of copies is very small, so it doesn't become a burden for the bacteria. So even if in the absence of antibiotics, they continue to exist. So this is the picture summarizing the title of my presentation today. The pathogenic bacteria and the enteric bacteria would have plasmids and ARGs, and they will get released to the river and the ocean. And as microbiological organisms, they get inactivated and get grazed. So as cells, they die, but DNA, the substance, would remain. And the remaining substance, what would happen to that? That will be used by the environmental bacteria. And once that happens, it will remain in the environment. So ultimate question is what's at the very bottom? How do these come back into the human environment? So that's the theme of the research. This is one example. This is an old example, PRA1 in the middle, the ring in the middle. That's Aromonas hydrophila. This was isolated from a fish. This was isolated in 1971 in Ehime Prefecture. This plasmid, year after year, from the 1990s to 2000s in the US or in Madagascar, as Yersinia pestis and Salmonella included, all these core structures were retained, and also insert sequences were added. Those were isolated in these different areas. That means plasmid travels between marine and human bacteria. That's indicated. The same plasmid with a more advanced study shows the follows. This is fish origin, and that is close with cow intestine PRA1, which is similar. This was reported from South America, and similar placid with Acinetobacter bautamae. This was detected in West Asia. In other words, the gene circulation is taking place on a global basis. So from fish to cow to humans, or from Iran to South America, how do they travel? Those pathways are not quite known yet. Next, inside the ocean in aquatic environment, are there any original ARGs? That's the natural question. In 2017, people in Sweden reported on this. So SAL 1, 2, 3 were very well known, but they looked at SAL 4, a new gene. This is called chloroflexi, which has been around for a long time. So that was found in chloroflexi. And SAL 4 sequence was looked up in a database. And it turned out they were deposited in the database already as unknown. And if you look at the origin, they're all aquatic. In other words, in aquatic environment, SAL4 exists in prevalence or in abundance. So what we did was, at our institute, there are quite a lot of stores or stocks. And of those, we screened those that are resistant to SAL4. And then there's alpha proteobacteria and gamma proteobacteria. About half of them have resistance against sulfur. And then as we looked more deeply, SAL4 accounts for about half rather than SAL1, 2, and 3. So SAL4 exists at a high rate in the ocean. So we came to know that. So maybe ocean might be the origin of SAL4. That's what we presumed or hypothesized. Or in the case of gene other than SAL4, maybe there are other unknown genes that exist in the ocean. This just came out last week, so please don't circulate this data. This just came out last week. There were 12 strains of marine bacterial genome, and genome were analyzed. And it turns out there are 4 types. And all of these have SAL4, but there's no machine or mechanism for communication transmission. What people in Sweden found was in SAL4 at L and ISCR20, those that are involved in the mutation of genes, they indicate that they would contribute to that. But if you analyze these, we don't find any, or FOL B or FOL K are added. What these mean is that these are the enzymes that would create the certain enzyme. So we imagine that there's an origin in the ocean, and it acts as a communicating agent, and they act as an enzyme to produce certain acid. Next is about conjugation. So they were able to conjugate to the recipient, and this is culturable. So we cultured it, and if the donor is in a good state, and then even in the ocean, it would be passed on to E. coli. And if you starve the E. coli, then it gets reduced, but the transmission still takes place. But if the donor is starved, then transmission or communication doesn't take place. And if you put organic matters, and then they would recover. So if there's abundance of organic matters for donors, they can recover. So that's what we found. So far, all the data are summarized and the conclusions are written in orange boxes. With the red arrow, we can say that there's contamination with organic matters and metals, certain types of metals, and low level of disinfectants. If they exist, then the dissemination gets accelerated. In other words, in the environmental bacterial community, dissemination and persistence can occur in the environment. So that's what we came to find out. Lastly, based on the evidence found, this cycle exists for sure, we came to find out. In other words, in clinical place settings and from wastewater treatment plants, when that gets discharged, it gets linked with aquatic bacteria and HTT can take place. And those that go into the environmental bacteria and they continue to persistence. And if there is a chance, then the bacteria containing certain genes can go back into clinical settings. So the ARGs from the environment can be a risk to human. So we came to find out with experiments and observations. So this is last slide. What we need to think about is how can we reduce the damages of the ARGs? One is to prevent the entering and releasing of ARGs. If you think about the human environment, I think the most important strategy is microbiology education. We need to educate and disseminate the knowledge. Another one is the habit of hand washing. These two, with COVID-19, thanks to COVID-19 in a way, these two got recognized widely by the people around the world. Legally speaking, the stewardship of antibiotics need to be regulated by law. And then at the private sector level, perhaps the food distribution can be innovated or cooking method can be explored further so that you don't end up eating suspicious meat. So in order to reduce the entering and releasing ARGs into the environment, we need these efforts. And as for the discharge point of wastewater, the wastewater treatment technology needs to be innovated. So for instance, it can be macro or activator. There may be other ways of innovating the wastewater treatment technologies. And on the animal side, the use of antibiotics, that needs to be regulated. That's certainly very important. What's shown here is these are typical proposals of mitigating ARG risk. There are other strategies, I'm sure. So as you think about that, the basic research should be conducted. So that concludes my presentation. Thank you for your attention. Thank you very much, Dr. Suzuki. I think just a few years ago, I asked or I had the opportunity to listen to your lecture, and I thought Mother Ocean can take care of all the problems, but it was quite shocking to hear your lecture. So from this point on, I'd like to engage in a free discussion after this. So the bacteria will go into the ocean, the Mother Ocean, silently. Then we get the counterattack, as it were. But the genes would transfer to bacteria that are related to human, and then they come back into the human world. Is that happening? So you talked about the commonalities and differences. I think that's an important keyword. So could you share your thoughts on that? Thank you. One example that is good is Acinetobacter. That comes back into clinical settings. This bacteria exists in the environment, but there's an exchange of gene in the environment. So there's that history. Or non-resistant bacteria could come into the clinical settings, and then there may be bacteria that are in the clinical settings. At any rate, the bacteria of different kinds encounter and the exchange of genes takes place, I think. Thank you. Dr. Kusumoto, do you have any questions? This is Kusumoto. Thank you very much for your very interesting presentation. Just like it was mentioned earlier, I thought once it gets to the ocean, it'll get taken care of, but that's not the case. So the bacteria in the intestines, the DNA competency is not that high usually. But for instance, the ocean, the concentration of bacteria is low. So the relatively, are there bacteria that have relatively high competence? Well, it depends on the situation. So the marine bacteria, you can't generalize whether they have high competence or not, but most have cases, it happens with biofilm. So the likelihood of freely existing bacteria colliding is very low. So where biofilm is created, especially where lots of different bacteria get mixed in, where the wastewater gets discharged, and there may be other spots. So we have investigated the wastewater from the horticulture or the swine farms. So the environmental bacteria, I think there are certain spots that we should pay attention to. And the bacteria themselves, the competency may get raised in such environment. So if there's a lot of mud, so that means spots where there are potential communities. Thank you. So if the ocean doesn't work, then maybe the sun, the ultraviolet ray can destroy the gene. And in that case, the ocean environment, would that pose lower risk and make it safer for a human body? Well, there's no telling. Well, the ultraviolet rays don't get penetrated into the ocean, actually. So the surface, the ultraviolet ray can become invigorated at the surface, but once it gets to a certain depth, it's quite stable. So we can't rely on the sun either. Well, I was trying to see if there are anything that we can do. Thank you for suggesting the different measures to be taken. Now we are running out of time, but in the animal world or in the environment, either in Japan or overseas, what are the challenges of AMR? In the case of humans, there's AMR measures and the environmental measures need to be approached. But from your points of view, could you talk about your view and the potential measures that can be taken? So Dr. Kusumoto, if you could start.
Yes, yes, as actually mentioned in my presentation, but I don't know whether is it selectively what is the cause of the spread? Is it widely spread in the farm, or is it because selected drugs are used in the farms? In the past, we thought it was the usage of the antimicrobial that caused the issue, but that's not the case, it seems. So the transmission, there are actually transmitted antimicrobials as well as selected antimicrobials. So depending on codes, we need to have a different control. I see. Thank you. Suzuki-san, Dr. Suzuki, do you have any comment on that? I know it's not easy to compare your field to the Dr. Kusumoto's field, but a simple comparison, the drugs, if you can actually control the dose and usage. That's probably easiest to understand. But if you look at bacteria, if you know what kind of disease it would cause and that it actually causes disease, then it's clearer. But genes, it's very difficult. We don't know how, it flies and how it enters. It depends. It all depends case by case. So while gene is the very basis, if you look at overall trend in the world, we are not monitoring the environment very well. But for environment, we just have not been able to have very good monitoring. It's a huge black box. And the only time that we actually see is when they come out of that black box. So the easiest thing is to catch when things actually jump out of the black box. As a researcher, we must have better understanding of the black box as well. Well, derived from that, if you're talking about the wastewater, who is in charge? When it comes to wastewater, is it human sector or is it animal sector? I think it's a Ministry of Land as well as Ministry of Agriculture. So two ministries, I think. I see. So, and at the end, it actually has an impact on the environment. So we do need to watch what is coming out of those water to the environment. And yeah, I think there are several universities like Tokyo University of Tokyo, University of Tokyo University. They are actually looking at what sort of bacteria are being released. Yes, and it's that such data has been shared nationally. Yes, I thought we do need to take another look at it. Dr. Suzuki, I know you talked about it, but in the environmental area, is there any issue or any measures that we could take? Yes, for environment, we have to closely monitor the situation and in the interface, the interaction between what is actually being released into the environment. I just would like to get more data at the point of interface, a point of exchange. Yeah, it's almost time. It's about time, right? Dr. Kusumoto and Dr. Suzuki, can you actually give us a closing remarks? This is Kusumoto speaking. Well, yes, Ministry of Agriculture and Farming and Agriculture and Fishery is now looking at ARG countermeasure, and they are beginning to, I think, monitor, and they're trying to decide how to monitor them. So they're having discussion, and it's been like 4 or 5 years. So we are a bit behind if you compare to Ministry of Land or Ministry of Environment, but if you think about farming, animal farming, there are some bacteria that would cause disease in animal. They do not necessarily cause disease in human. So the food poisoning bacteria does actually stay with human and cause problem. However, they do not really have an issue with AMR. So there are different types of AGR that's being shared and stored and transmitted among human, among animals. And so we have to look into that risk. Okay, thank you. Dr. Suzuki, please. Well, this symposium big theme is One Health. So One Health, we have to actually fuse or different fields. It's actually about human. We have to understand each other. We have to understand the learnings in the different fields and share them. So we need to actually cross sectionally look at different sectors. Those of them that are maybe doctors need to look at environment, people working with wastewater needs to look into the forestry. Maybe all those things are important. Yes, okay, well, let me have a closing remark. I know society is really struggling with COVID-19, but there are people also dying out of AMR. So it's very relevant that it's going to become a next large impact on the human society. So while we have to work on COVID, we do need to also look at the AMR issue from the One Health approach. So let's close the meeting with such thoughts. Thank you so much for your attention. Thank you. So this is the close of the second subcommittee, AMR. Thank you for your attention.